Today we'll be conducting the saliva check buffer test. This is an in vitro test for checking the quality, pH, and buffering capacity of saliva. Prior to any visit where a saliva diagnostic test is planned, the patient should not smoke, consume food or drink, brush their teeth, or use mouthwash for at least 1 hour prior to the scheduled appointment time. We'll be conducting 5 tests today. The first 3 test the resting saliva. Test 1 is a visual inspection of the level of hydration. Test 2 is the saliva consistency test, and test 3 is the pH measurement. The last 2 tests will test the stimulated saliva. Test 4 checks the quantity, and test 5 checks the buffering capacity. Test 1. This is where we will visually assess the lower lip labial gland secretion. Evert the lower lip, gently blot the labial mucosa with a small piece of gauze, and observe the mucosa under good light. Droplets of saliva will form at the orifices of the minor glands. If it takes greater than 60 seconds to notice these droplets, then your patient has a low resting flow rate. If it's between 30 and 60 seconds, then the patient has a normal resting flow rate. And if it takes less than 30 seconds to notice these droplets, the patient has a high resting flow rate. Test 2. Here we will visually assess the resting salivary consistency in the oral cavity. If you see sticky, frothy saliva with residues, that means the saliva is very viscous. If you see frothy, bubbly saliva, that means the patient has an increased viscosity. And if you see watery, clear saliva, then that patient has a normal viscosity. In test 3, you will have the patient expectorate any pooled saliva into the collection cup. Take a pH test strip and place this into the sample of the resting saliva for 10 seconds. Then check the color of the strip. The strip should be compared with the testing chart available in the package. For test 4, we will check saliva quantity. Have the patient chew a piece of wax to stimulate salivary flow for 5 minutes. The wax is unflavored because we are mechanically stimulating whole saliva. The flow rate is different if you are using a sour taste to stimulate whole saliva. Expectorate all the saliva into the collection cup at regular intervals whenever the patient needs to. The quantity of saliva can be measured by checking the milliliter markings on the side of the cup. Note the quantity of saliva at the 5-minute mark. If your patient has less than 3.5 milliliters, you will mark them down as very low. If the patient has 3.5 to 5 milliliters, they are low, and if they have greater than 5 milliliters in the cup, mark them down as normal. For test 5, we are checking buffering capacity. Remove a buffer test strip from the foil package and place it onto an absorbent tissue or gauze with the test side up. The buffer test pads are impregnated with differing amounts of lactic acid. Using a pipette, draw enough saliva from the collection cup to dispense 1 drop onto each of the 3 test pads. Immediately, turn the strip 90 degrees upwards along the long edge to soak up any of the excess saliva on the absorbent tissue or gauze. This will prevent the excess saliva from swelling on the test pad and possibly affecting the accuracy of the test results. The test pads will begin to change color immediately, and after 2 minutes has elapsed, the final result can be calculated. If the saliva has a low buffering capacity, the test pads will remain red. If the buffering capacity is intermediate, the test pads will appear blue. And if the saliva has a normal buffering capacity, all of the pads will appear green. The final result can be calculated by adding the points according to the final color of each pad. Thank you for watching this saliva check buffer demonstration. If you would like to perform this test on one of your patients in the clinic, please find Dr. Yates or Dr. Kahn for the supplies.